Here are two things that I want you guys to know before you let someone artificially break your water in the hospital. Someone may offer to break your water as part of an induction of labor or as a means of speeding up or augmenting your labor. Number one is how dilated you are. If you are allowing someone to break your water and you are not very dilated at all, you are risking having your water broken for a prolonged period of time, which may increase your risk of infection. So you can have a conversation with your provider about when they want to do it, why they want to do it, and what the other options may be if you don't do it right in this moment. Number two is I want you to ask the station of your baby's head. Obviously, we don't always know when emergencies are going to happen, but in order to reduce the odds of a cord prolapse, which is an obstetrical emergency and requires an emergency C-section, your baby's head should ideally be well applied to the cervix and at a lower station. If your baby's head is way high in your pelvis and it's floating up there, or ballotable like we call it, meaning that you can kind of just push it away from the cervix and it is not low and well applied to that cervix, that increases your risk of a cord prolapse. And a cord prolapse is when the cord comes down under the baby's head, in between the baby's head and the cervix, and the baby's head can basically compress it and cut off its own blood supply. So you can consider having a conversation with your doctor about what station your baby is in and if their head is well applied to the cervix. No provider should be trying to break your water if the baby's head is really high or not well applied to the cervix. Have I seen it happen? Yes. I'm giving you a couple more talking points to ask your provider in case they are not talking to you about these things so you can make a more informed decision during your labor and delivery experience.